Late last year, the Grandchildren's Health, in coordination with Healthy Yancey, secured a grant from Yancey Foundation to provide emergency medication assistance to the students of Yancey and Mitchell County. As coordinator for the My Meds Medication Ministry, I was asked to administer these funds. The funds have been used in a variety of ways. As most of you know, if a child in North Carolina can't get Medicaid and doesn't have insurance, most of them can get Health Choice. We have, however, had several unique situations, one in which a child moved to Yancey County from Florida, and because of the wait time that it took to get the Medicaid instated in North Carolina, this child went 2 months without medication for ADD and ADHD. During this 2-month period, school started, and the child simply could not function in the school setting without the medication. We used funds from this grant to help secure the medication this young lady needed to keep her functioning until the Medicaid became effective and she was able to go on the state program. Another way that we've used these funds, and it actually was a little surprising to me, is that there are a lot of children out there who are either in single income families, both of their parents are laid off, and they actually have health insurance. But if they come up needing a medication and it has a very high copay, then sometimes the parents simply can't get it. We had one instance where we had a young man who had severe allergies, especially to bee stings. School started this past fall, and he didn't have an EpiPen. The nurse in the school was just beside herself because Mom and Dad could not afford the $50 copay for the EpiPen. We were able to provide that. We've also provided a copay for a very expensive antibiotic that Mom and Dad could not afford the copay for when the more affordable antibiotics, the cheaper antibiotics, the generics, just had not worked. We've also helped another family with ADHD medication. The grant is administered through the My Meds program, but I work with the school nurses. If a parent goes to a school nurse or a school nurse herself identifies a need, then the school nurse calls me and I will make arrangements to provide these medications, and the school nurse then goes back to the family and tells them when and where they can pick them up.